Can you explain, I know it's a huge thing, but can you explain sort of like fairly in a nutshell to a layperson what data collection is? It's not just collecting envelopes.
No, although it can be collecting envelopes full of data at times, but there's two kind of projects that I was describing in the lecture. One of them is trying to reuse pre-existing research data. So all over the world, and in our case all over Europe, people are volunteering for clinical and other studies. Generally, you volunteer for a study, the researchers that you interact with use your data, and that's more or less the end of it. What we're trying to do is to say, for all these research cohorts, why don't we use that data again for something slightly different and ask a different question of the data? So we set up a platform that enables researchers to say what data they've got available, and then the scientists who want data, and the data might be clinical data, it might be brain scans, it might be molecular data, all sorts of different types of data. Researchers can see what's available, and then they can go and ask the researcher that collected the data in the first place, can I work with you to use that data? And underlying that, the person who participated in the research study, the volunteer, has to have given permission for that to happen. So we've got a database and website and so on that researchers can now see what's available all over Europe. So it's about data visibility, and that's the most important thing. The other kind of data that is collected is sometimes called routine care data or real world data. So every time you go to a doctor, every time you have a hospital appointment or an intervention or a test, data is collected. So all of the questions that are asked of you or you have tests for, that's data. And it's used for your health care, and we have now set up a system that lets researchers use that data completely anonymized, so nobody knows it comes from you as a patient, but lets researchers use that data to find out things that would be helpful in our fight to stop Alzheimer's disease.
What have you found to be the most exciting thing about your data collection information gathering?
That's a very good question. So let me give you a few instances. I mean, one of the things that I found most exciting was when we were able to show from just routine care data, from letters that doctors write to other letters about people. We use natural language processing to get information from those letters, and in huge numbers of people it turns out that drugs like donepezil have exactly the same effect in the real world of ordinary clinical practice as they did in the experimental research. Now, in all honesty, I didn't really expect that. Often you find better results in a research project than you do in the real world. It gets sticky, difficult, messy in the real world. Turns out not to be true. These drugs, and I found that the process of doing that research amazingly exciting. But what I'm really excited about now is doing the next step and finding out about new drugs and being able to sort of what I think of as triangulation or bridging between really complicated molecular data to the kind of ordinary data that I collect with my patients, and trying to work out what the actual processes are in dementia and find new drugs. So we're using these big data in really imaginative, innovative ways, and doing things in literally months that would previously take years and years and years. So I think more of us in the research community will do this if we have more and better data, and if we have some smart young mathematicians joining us, we can make progress towards real treatments for people with dementia quicker than we otherwise would have done.